Hello, Dr. Cook. This is Alicia Lee Selwyn. This is my final presentation, Understanding Nicole Through Component-Based Psychotherapy. I think I really should have titled it Understanding Myself Through Nicole Within Component-Based Psychotherapy. Um, just because I learned a lot about myself too through this class and through Nicole. So here we go. So, Nicole has a history of chronic emotional abuse and she also has disorganized attachments. So, when I think about how I would show up for Nicole as her counselor, um, I think the most important thing for me would be to begin with containment and safety and stabilization, really building trust with Nicole. My role would be to provide that consistency with the level of care and engagement and emotional holding to be a witness to her suffering, which the goal would be to counteract the instability that she did experience and the damage that her mother did to her. We know that relational trauma and attachment trauma occurs within the relationship and also is healed within the relationship. So I would also expect for enactments to occur, like I would anticipate those. And we know that enactments are inevitable, but within those enactments is always an opportunity for growth. And it's within the repair that we do with those enactments that really elicit healing and growth, not just in Nicole, but also in myself as a therapist or a counselor. And so anticipating those enactments and then openly repairing the ruptures as they occur, much like Catherine did in this case study with Nicole. Before any of the narrative work would be able to occur, Nicole needs stabilization. Like I said, she needs to feel safe. I need to build trust. Her dysregulation and her tendency towards dissociation mean that regulation must come first before she can get into any of the narrative. I would rely on pretty heavily on somatic practices, breathing, grounding, interoception to help her expand that window of tolerance so that she could sit with those more heavy feelings and engage with them once she develops some tools of regulation. Supporting Nicole's agency is crucial. Techniques would be collaborative, never prescriptive, to counteract the powerlessness that she lived with as a child. So it's important that she feels included in like this therapy, this treatment is hers. It's not my place to be prescriptive or to tell Nicole. It's my place to guide her and lead her and collaborate with her to find meaning within herself and initiate healing. Um, Finally, I would stay aware of my own internal reactions and seek supervision on a regular basis to prevent any of my own attachment patterns or my desire to be a good therapist, my desire to help Nicole, my desire to really initiate a breakthrough with Nicole, um, from creating reenactments. So, supervision would be crucial. Definition of trauma. Trauma is not defined by any one single event, but it's a chronic relational injury. It's not defined by one single event in what happened to us, but how we've been affected by what happened to us. Psychological maltreatment is a repeated pattern of behaviors that make children feel flawed, unloved and unsafe. They communicate feelings of worthlessness to the child, which does significant damage. This then turns into complex trauma, which is a form of repeated interpersonal harm occurring during the development. Complex trauma disrupts normal child development milestones because survival takes priority over healthy emotional, cognitive, and relational growth. The consequences of complex trauma are lifelong. It produces chronic dysregulation, problems with impulse control, dissociation, low self-worth, and relational difficulties. Um, a defining feature is that the client's present life is inseparable from the experiences of the past. Whether they are able to make those connections and identify that doesn't matter. It's a very defining feature that their present life is inseparable from the experiences of the past because of the effects that the experiences of the past have elicited on who they are today. So, reflection on Figure 1.1 component based psychotherapy framework. Um, Figure 1.1 emphasizes that component based psychotherapy is not a step by step model. Um, the four interacting components of relationship, regulation, parts, and narrative continuously influence one another. So, for example, helping a client or a patient regulate physiologically inherently strengthens the relationship, which in turn supports narrative and parts work. A major lesson for developing counselors in training, is that the therapist is part of this model. Our own emotional regulation, attachment history, and self awareness can directly influence treatment outcomes. An unchecked therapist biases or insecurities can lead to enactments, as seen when Catherine misinterpreted Nicole's Pretty Woman reference and how that led to a disruption in their relationship. Finally, the outer ring of culture and context reinforces that trauma cannot be separated from societal realities such as discrimination, socioeconomical barriers, or oppression. Developing counselors must cultivate cultural humility, not just cultural knowledge. So, treatment's non-linear and interconnected. A therapist's own system affects all four components. Culture and context shape trauma and healing, and it is our ethical responsibility and imperative that we seek supervision, and self-awareness is essential. The relationship component in component-based psychotherapy. So, in component based psychotherapy, the relationship component is one of the four central pillars. Because survivors of chronic childhood emotional abuse and neglect were deprived of safe and nurturing bonds, therapy then becomes like a partial surrogate, holding an environment where clients can develop safety, self understanding, and regulation. The goal is to build relational capacity and consistently repair disruptions in attunement. For clients like Nicole, the main challenge is bridging what the authors have called the abyss, which is that internal experience of the desperate longing for closeness while simultaneously fearing it. As a counselor, this will require warmth, empathy, transparency, and collaboration. High quality interpersonal skills then aren't optional at all. They're actually the strongest predictors of positive outcomes in complex trauma work. The challenge will be to bridge the client's longing and fear of closeness. And the stance to do that would be through warm, collaborative, empathetic, and high interpersonal skills. Nicole's relational profile. So, when we map Nicole onto the four relational dimensions of openness, expressiveness, connectedness, and power orientation, um, a disorganized attachment pattern becomes very clear. She exhibits disorganized attachment. So, examples of this and evidence of this is in her openness. She swings between a deep guardedness, but then also like a sudden extreme vulnerability of sharing information. For example, when she reveals to Catherine her affairs, and then immediately she asks, like, "How disgusted are you?" Um, in her expressiveness, she's highly constrained. She tries to control her emotions, but then she speaks about painful experiences in like a really flat, detached way. In connectedness, she feels extremely isolated, but she attempts to escape that emptiness by rushing into marriage and seeking pseudo connections through one night stands. In power orientation, she's compliant and other focused, shaped by experiences of feeling worthless as a child. Across all the dimensions, the therapeutic aim is to help her move more toward a balanced center where she can engage flexibly and authentically in her relationships. Self-reflection on the dimensions of the relationship component. So for me as a counselor, maintaining that balanced position on all dimensions is essential. What this means to me is being open, expressive, and connected, but not too overly involved, and being assertive while still being collaborative with Nicole. My own lived experience has really helped me learn to come back from extreme ends of these spectrums, as I've learned a lot and grown so much through the work that I've done in therapy over the last 5 years. Um, Maintaining a balanced stance helps prevent reenactments. Not all reenactments are preventable, they're just going to be inevitable. But that balanced state can help prevent them, and it also models the flexibility that Nicole has never experienced. Nicole and I believe, would work well together as long as I'm balanced and stable and attuned. And this will be the structure that she'll need for regulation. Her compliance style means that she'll engage reliably, which helps build early momentum. Because consistent repair of misattunements can provide the corrective experiences that she had never had growing up. And this will offer moments of growth and healing and also trust building between her and I. Some of the challenges that will probably exist is that her disorganized attachment style can create this push pull dynamic between us, as she might reach toward closeness but then retreat into isolation. Her compliance can mask distress, meaning she may look fine while internally she's actually struggling. And she may test the relationship through provocative disclosures, which may very well have the potential to activate my own insecurities. Recognizing these dynamics early can help me stay grounded, responsive, and attuned. The regulation component. So, the way that dysregulation presents in adult survivors of childhood emotional abuse and neglect can vary greatly, but it is measured in CBP across these four dimensions of the regulation component, which is a scale that is used to assess this wide variation in the presentation of regulation and dysregulation. The four dimensions are arousal level, consistency in a regulatory state, directionality of expressions of distress, and degree of control. The scale helps us as counselors with early and ongoing assessment of self regulatory capacity to help understand our clients better and inform our development to the most effective approach to mitigate regulatory capacity and help build those regulatory skills through our therapeutic relationship. It's one of the four pillars of component based psychotherapy, and it's considered the essential foundation for treating complex trauma. In CBP, self regulation means helping survivors learn to identify, tolerate, and modulate their internal states, whether emotional, cognitive, behavioral, or bodily. Complex trauma fundamentally disrupts regulation across multiple domains. This includes effects like mood swings, numbness, impulse control or lack thereof, compulsive behaviors, trauma based cognitions, physiological hyperarousal or shutdown, and relational distortions. Dysregulation can appear loudly like rage, panic, or quietly like withdrawal and chronic emptiness and depression and isolation. Because of this, treatment must begin with building stabilization and regulation capacity. Without that foundation, clients cannot engage meaningfully, and it's almost like an act of disservice as a counselor if you don't establish that first, because it can actually create more harm. Um, so, without that foundation, clients cannot engage meaningfully in trauma processing or memory work or narrative integration. So, you're really harming your client and your patients if you don't um, build your foundation with stabilization and regulatory capacity. Sorry. So this is Nicole's regulation profile. Her her patterns are linked to dysregulation. On this slide, we're going through the lens of the component based psychotherapy model, which views complex trauma clients as fundamentally dysregulated. And Nicole's profile clearly reflects this. Like I said, her patterns are linked to dysregulation. First, on the arousal dimension, she swings between two extremes. She goes from intense hyperarousal, where she feels a rush of or aliveness during her risky behaviors, and deep hyperarousal, where she collapses into numbness, exhaustion, and overwhelming aloneness. Her regulatory state is also highly volatile. She shifts from rigid emotional control to sudden impulsive actions. Even her body communicates this instability, moving from to tight protective contraction to bursts of aggressive energy. In terms of how she expresses distress, she carries heavy internalizing symptoms like hopelessness and self disgust, but she also externalizes her pain through her increasingly reckless affairs and one night stands, which function as an attempt to escape the emptiness inside of her. Finally, she goes between over control and loss of control. She's spent her life trying to be the good person um, by tightly managing her emotions, but the rigidity of that coping strategy eventually breaks her down, leading to behaviors that she describes herself as getting out of hand. When viewed together, all of these patterns show us the quintessential dysregulated client. Her patterns are just that. She's the prototype of a dysregulated client. For Nicole, the therapeutic goal is not simply to reduce her symptoms, but to help her move more toward a balanced center. on each dimension where she can engage more flexible, tolerable, and integrated self-regulation. Okay, so self-reflection on my own regulation profile. This is the fun part. So we'll start with arousal level. So pre-therapy me would swing really hard back and forth between hyper and hypoarousal, like quite frequently. I had lots of meltdowns, lots of emotional outbursts, and then I would swing to the other extreme of numbness, blocking it all out, dissociating, isolation, exhaustion, and depression. The me today, I'm more alert and calm, although I am human and sometimes I revert and I can still have meltdowns. But 5 years of therapy and recovery has really helped me do a lot of work to make sure that I stay balanced and I know how to handle myself when I do become dysregulated. I have the tools now to slow down and reground myself, and I'm much more aware of when I'm not feeling like myself and when I need to ask for help from my support system. Um, Inconsistency of regulatory state, the pre therapy me was highly volatile. I was constantly in crisis mode, dysregulated, very manic, extremely moody, and I I experienced distress pretty heavily from overwhelming emotions, and at times I was volatile and would turn to substances to mitigate. I also participated in risky behaviors and reckless behaviors, and I felt addicted to toxic relationships. The me today is flexible. I stay regulated in a way that when I do experience difficult emotions and feel myself becoming triggered, I can take 2 steps back to sit with myself and ask myself what is showing up for me and reground, but also take the time to process things from a less reactive state. I do my best to not react to emotions, but rather bear witness to them and seek to understand them. Directionality of distress, internalizing and externalizing. So pre therapy me was very much like Nicole. I had a lot of internal pain in the form of anxiety and depression, and I masked that pretty heavily. Um, my external actions were compulsive. I did a lot of risky behaviors, unsafe, reckless behavior. I did sleep with strangers. I did have one night stands. I did drink and drive. I did do very stupid things that I should be grateful that I'm still alive, and I am grateful. Thank you to the grace of God. Um, but I was unsafe. I did reckless, risky behavior to escape that internal emptiness and that internal black hole. The me today, I am adaptable. I participate in therapy every single week. I can't imagine my life without it because of the significant impact it has had on me in changing my entire life for the better. I'm also pretty heavily involved in my culture and ceremony, and I nurture my faith in my relationship with God in order to mitigate anxiety and depression. Um, I have identified the things that I need to do to check in with myself when I'm experiencing anxiety and depression. I always seek support and help, and I always rest when needed and slow down and reground. Degree of control, over controlled to under controlled. Once again, the old me identifies pretty parallel with Nicole on this one also. I was always either doing really, really well or extremely bad. There was rarely ever an in between. Um, I did have a lifelong over control to stay the good person. You know, as a child, I wanted to stay the good child. I wanted to do good in school to keep peace in my house. And that or to people please my parents so that they would be happy with me. And that could help mitigate the walking on eggshells feeling, or the deep sadness and rage. And, that really transpired over into my adult life. That people pleasing and that over control of staying the good person. But it broke down into out of control behaviors, getting more out of hand. But then the me today, I sit in the middle with active acceptance. Once again, I am human and I'm not perfect. And I'm not saying that I'm completely healed, because healing is not linear, and I'm human and I still make mistakes and I still get triggered, and I still sometimes get really stressed out and have outbursts or meltdowns. But for the most part, I've gained the tools that I need to live a more balanced life. And I'm so grateful for that once again, by the grace of God. Um, I sit in the middle with active acceptance. So I don't stress about those things that I cannot control. And I do not try hard to overcompensate as a way to make myself feel better. I give myself room to make mistakes, room to be human. I have grace, and I focus on learning and growing from those mistakes rather than beating myself up and diving off the deep end and spiraling out of control. Um, Overall, I believe that I exemplify the middle of each dimension of regulation. And my goals, my therapeutic goals, are always to continue to grow in my emotional maturity and to better understand myself and the emotions I bear as they come, and continue to find and express healthy ways of coping and processing those emotions. So, dimensions of the regulation component, synergies and challenges. So, strengths and challenges. So, my ability to mitigate the situation based on recognizing myself in Nicole could be a strength, as well as a weakness. Um, but it does offer me a chance to help Nicole co regulate, and I might be able to better tell when she's masking internalization. But some of the challenges that would be presented would be that push pull dynamic that will exist because of her disorganized attachments. She will try and test me, to gain trust, to gain her trust. She will try and test me, and her fears of being judged by me, and also those enactments that are inevitably going to occur. Um, and also seeing myself in Nicole, it could be hard for me to handle. Like, I would have to not overly try and save her or overly identify her, because I can't let my own personal experiences and biases lead our therapeutic relationship. And also, what has worked for me might not work for Nicole. The dissociation component in CBP parts work. Component based psychotherapy explains dissociation as parts of the self that become fragmented due to the chronic trauma. These parts form to protect the client from overwhelming emotions, sensations, or memories. In CBP, we assess dissociation across 4 dimensions. The first is cohesiveness, which looks at how well someone's parts work together versus being split and conflicting. Second is engagement, which refers to how connected the person is to their external world. Clients may space out or lose narrative continuity. Third is embodiment, which measures how connected someone is to their body and internal sensations. And the last is the level of resources, which looks at whether the person can access adaptive coping strategies or whether their parts function in extreme ways. The therapist's goal is always going to be to help the client move toward the center, toward balance, toward cohesion, toward connection, embodiment, and to access their internal strength. So, in the CBP model, Nicole represents a client operating at the far fragmented end of the four dissociation dimensions. Her internal world is split between her good girl part and her impulsive part, and these parts of herself view each other as foreign and even dangerous. She also shifts into dissociated states pretty quickly, especially when she feels misunderstood. Her disembodiment is reflected in her physical posture and her reliance on high risk behavior to feel alive. Finally, she's under resourced. Her parts don't have access to adaptive coping strategies. From my perspective, CBP requires me as a therapist to stay cohesive, present, embodied, and well resourced. This allows me to serve as a stabilizing figure who models integration, validates each of Nicole's parts, and helps her reconnect to her body. However, the work also brings challenges. Nicole's attachment trauma may lead her to test the relationship or shift rapidly into dissociation. Working toward cohesion can also activate internal conflicts between parts. And because Nicole's child parts are so deprived, there's a risk of over nurturing. As a therapist, I must balance my compassion with boundaries to help Nicole's adult self develop the capacity. The narrative component. In component based psychotherapy, the narrative component is really about helping clients make sense of their lives in a way that reduces their shame and gives them a more hopeful path forward. Instead of viewing their current struggles as personal failures, we can help them see these patterns as survival strategies that came from early adversity, which Hopper and colleagues emphasize. Narrative work supports integration, bringing together the parts of the self that feel disconnected or contradictory. The model describes four narrative dimensions, each with a continuum. The goal is always flexibility and integration, accepting memories rather than avoiding them, sharing trauma stories mindfully instead of hiding or spilling them, forming an identity that's bigger than trauma, and bringing fragmented pieces of the life story into a cohesive whole. When we apply these dimensions of the narrative component to Nicole, it's pretty clear that she carries a deeply fragmented story. Her memories are vague and pretty numbed out, but the emotions tied to them show up intensely in her body and self talk. She holds a lot of shame, so she stays mostly secretive, but she also has moments where she spills too much all at once, usually as a way to test her relationship with the therapist. Um, Her sense of identity is the hardest part. She sees herself as broken and defines herself through the messages of her early emotional abuse, which is quite sad. This leaves her story split between her compliant good girl facade and the parts of her that act out. Narrative work goes far beyond retelling traumatic work events. Instead, it helps clients understand how different parts of their identity, particularly those that became fragmented or underdeveloped due to trauma, fit cohesively into a story. A major purpose is to transcend the trauma, creating a future oriented narrative that gives the client a sense of purpose and hope in their lives. It also helps them understand that many of their long-standing struggles, like overcompliance or relationship difficulties, developed as survival mechanisms, coping strategies, survival strategies during that early adversity. This work is part of phase 2 of trauma treatment, and it only occurs once safety, emotional regulation, and stabilization are firmly in the foundation. But even in early treatment, clients reveal their narrative in subtle ways, such as beliefs like, I am bad, or others aren't safe, or I can never do anything right. Um, the goal is to move from fragmentation, what CBP calls the void of self, toward coherence and integration. Um, I do know that therapists also carry their own narratives, and I want to say that too because we do, and that's part of being aware of our biases and being aware of our narratives so that they don't affect our ability to serve our clients. Um, they influence our attention, reactions, and biases, and our narrative awareness is essential in supervision. Um, the narrative component isn't only present in the client, it lives within the therapist. Each therapist carries their own personal and professional story, complete with biases, motivations, blind spot, and identity driven needs. These narratives inevitably will show up in the therapy room. They influence what the therapist pays attention to, what we might avoid, how we emotionally react to the client. For example, a therapist who needs to be seen as a good person or a good therapist may struggle to engage fully when a client expresses their own bad, angry, or messy parts. Because of this, CBP emphasizes that supervision must include ongoing exploration of the therapist's narrative. This will help prevent reenactments and ensures that the therapist's story doesn't overshadow the client's healing process. In this way, both the client and therapist are working toward deeper self understanding, integration, and coherence, which strengthens the therapeutic relationship and supports genuine trauma recovery. As the counselor, my own role is to stay grounded and integrated so that I can model stability for Nicole. My own inner parts, especially the part that wants to be seen as good, seen as a good therapist, seen as a good person, can easily get activated and work like this. So, self awareness really is key, and supervision is a huge part of that. It's actually essential, crucial to our success as therapists and people in the helping profession. Some challenges will include navigating enactments, helping her tolerate narrative work without shutting down, and supporting her through the resistance she'll feel as she starts to build a more integrated identity. But with consistency and attunement and continuous commitment on my own growth and work, these challenges can also be the foundation for healing. This is the final slide, integrating CBP, personal growth, clinical insight, and lessons from Nicole. So, as I look at this work through the lens of component based psychotherapy, I can really see how much a therapist's own growth is tied into the client's healing. Working with somebody like Nicole, whose emotions shift so quickly, whose attachment patterns are chaotic, and whose parts are constantly in conflict, would push me to grow both professionally and personally. To support her, I'd have to stay grounded and really aware of what's happening inside of me. That means noticing when my own parts get activated, like the part that wants to seem like a good person or a good therapist, or the part that feels overwhelmed by shame or frustration. With someone like Nicole, I'd really have to pay attention to catch enactments early and repair misattunements, and to stay open to every part of her, even the parts of her that act out in ways that I feel are completely destructive. That kind of presence isn't just clinical technique, it takes real emotional maturity. Her disconnection from her body would also help me pay closer attention to my own. To co regulate with her, I'd need to be aware of my own breathing, my posture, my sensation, and emotional cues and how they show up in my body. Sitting with her intense feelings of rage, shame, and fear without shutting down or jumping in to fix things would really require me to expand my own window of tolerance. In a way, her story becomes a mirror that helps me strengthen my ability to stay steady in complexity. Her dissociation would also sharpen my attunement. I'd have to notice her subtle signs, her shifts in tone, posture, eye contact that signal parts movement. In trauma therapy, those small moments are often the intervention. Learning to validate the adaptive role of each part, even the ones that cause harm, pushes me to grow in compassion and reinforces that idea that trauma survivors are not bad people. One thing that this program has really made clear is that CBP components, relationship regulation, parts, and narrative show up in the therapist too. My own unresolved conflicts and unintegrated parts will show up in the work, which is exactly why supervision is so important, why supervision is crucial, and why that commitment to growth, continuous growth, is basically our ethical responsibility as people in the helping profession. It gives me space to understand my reactions and stay grounded. I also learned that sequencing matters. Without regulation and internal safety, deeper parts or narrative work can actually be really harmful to patients and clients. Trying to analyze Nicole's shame or impulsivity too soon would simply recreate the um, misattunement and negative vibe that she's already experienced in her life. Maybe the biggest lesson is that trauma is a rupture in relationships, so healing has to happen in relationship. Using parts language, honoring younger parts, and being flexible rather than rigid creates the connection that trauma survivors really need. And finally, I've learned to accept that trauma therapy is not linear, healing is not linear. It can feel confusing and oftentimes unpredictable, almost like stepping into Alice in Wonderland. But instead of resisting that, I'm learning to stay grounded in curiosity and compassion. In the end, my growth as a therapist isn't separate from the client's healing. Working with someone like Nicole helps me expand my tolerance, it deepens my embodiment, and it strengthens my internal cohesion. This work is challenging, but it's also incredibly humanizing. And through this shared process, both therapist and client move closer to integration and wholeness. And I just wanted to say thank you so much for this class and everything that I've learned and all of the things that I have learned about myself through reading these books and through working through these case studies. I really learned a lot about myself, and I have a clear focus of my commitment to continuous growth and moving forward and being of service to helping others. Thank you.